The views expressed are solely those of the speaker and not necessarily those of Paltalk.com, AVM Software, or its advertisers.
News Talk is online. News Talk Online is a production of Paltalk.com, the largest multimedia interactive program on the internet with more than 4 million unique users, on demand on iTunes and on YouTube, and on my site, GaryBaumgarten.com, where you are encouraged to post your comments, whether you agree with yours truly or not. No retribution. And thanks to our good friends at CRN Digital Talk Radio. We're syndicated into 12 million additional households. I am your host, Gary Baumgarten. Welcome to the show. To my right, your left, Kevin Robert Frost, who is an AIDS activist. Why do we have Kevin here today? Because today is World AIDS Day. In fact, this is the 20th anniversary of World AIDS Day. And it's really important this year to be discussing this issue, in my opinion, on two counts. One, because it's tough financial times out there, and it's hard to raise the money necessary for putting food on our own tables and gasoline in our cars, and the contributions, the concern is worldwide to the fight against AIDS are starting to wane, and that's not a good thing. And they're competing against all these other important programs and interests as well. And the second reason, in my opinion, is ever since Magic Johnson decided to show us all that AIDS is curable, quote unquote. He's like a real anomaly, the guy is. The interest and the focus on the problem has waned a lot, and we need to really focus on this. I want to throw a few stats out before I properly introduce you. About 56,000 new HIV infection cases are reported here in the United States alone every year. According to the American International AIDS Foundation, more than 25 million people have died from AIDS thus far worldwide. The foundation says some 39 million people around the globe are HIV positive. About 3 million people lost their lives from AIDS, 3 million in 2006, the last year for which we have statistics. That same year, nearly 4.5 million people were newly infected with HIV. About 11 out of 1,000 adults aged 15 to 49 are HIV positive. 25 million children will be orphaned by 2010 because of AIDS. The problem's not going away. It hasn't been cured. So joining us today to talk about the situation, AIDS, not just here in the United States, but globally, Kevin Robert Frost. He is CEO of the Foundation for AIDS Research. Kevin spent 4 years at NYU Medical Center working on HIV/AIDS research. He also worked at Bellevue Hospital here in New York City, where the poorest of the poor end up. And I'm sure you saw a huge influx of people who were HIV positive. In '98, you worked extensively in Asia, facilitating development of Treat Asia, a network of more than 50 hospitals, community clinics, NGOs, and healthcare facilities treating AIDS patients in 17 nations. Welcome to News Talk Online on Paltalk.com.
Thanks very much, Gary.
How close to the truth were my facts?
They were relatively close, I think. Closer than most.
Closer than most,
yeah,
huh? Well,
sure.
I did a little research, and, you know, of course, this is an inexact kind of thing, trying to figure out how many people. It doesn't really matter.
It's not. It's built on models, so they're not exact numbers.
Right.
Your numbers were about a year old.
Uh-huh.
We have newer numbers in
Okay.
2007. So we have numbers that suggest about 33 million people are living with HIV today.
Okay.
But that's a range between 30 and 36 million based on the models that we currently have.
Right.
2.9 million people died in 2006. In 2007, it was about 2.5 million.
So it's gone down a little bit.
Looks like it. It's hard to tell if it's going to be a long-term trend, but I think in many areas we are making progress.
I'm hearing that kids are going out. They don't even. Back when AIDS was a big issue, everybody was taking proper precautions. Now I'm hearing that kids, 15, 14, 16 years old, are out having sex unprotected, as if it wasn't a problem any longer, and they're getting all kinds of sexually transmitted diseases. And this, of course, is the deadly one, and they're
Yeah.
really playing with like Russian roulette, aren't they?
Yeah. Well, there's a lot of reasons why 56,000 people in this country continue to be infected every year.
Right.
And that's a number that is and should be unacceptable to anyone who's involved in this epidemic. Clearly, we as a country have yet to get serious about fighting AIDS, because there's many things that we could be doing to bring 56,000 down to 5,600, maybe to 56, if we were serious about fighting this epidemic. And so far, we haven't been serious about it. I think the last 8 years of the current administration have really sort of highlighted the failures of our efforts to fight this epidemic here in America.
This administration won't even approve, didn't, I shouldn't say won't because they're on the way out, but funding for any program, not even domestically, but internationally, that included passing out condoms and recommending to people that they use condoms.
They had a hard time with condoms. There's no question about that, because it was seen as sort of a reproductive health issue, and that I think the administration was concerned about, because it also implied that people were having sex, which obviously
God forbid.
This administration was not very comfortable with.
Right.
The bigger problems, though, I think, were that this administration didn't focus on the tools that we already had for fighting the epidemic. So instead of focusing on things like harm reduction and syringe exchange for drug users,
right,
instead of focusing on the rising epidemic among men who have sex with men, they chose to focus on programs like abstinence only,
right, or
abstinence until marriage programs, which are not proven to work, and in fact, in some circumstances, have even shown that they can be detrimental. They chose to focus on ideology over science. Mm-hmm. And that, I'm afraid, has led to some real setbacks here in the domestic epidemic. Now, this administration is not without some progress too. Certainly, the Bush administration has done more to fight the international epidemic, to make resources available internationally than any administration had previously. They put fighting AIDS in Africa and providing treatment to people with AIDS in Africa at the top of the agenda in a way that no previous administration had ever done before, and also really and truly put their resources where their mouth was.
Africa is the epicenter still of this epidemic.
It largely remains the epicenter of the epidemic, although we have rapidly increasing epidemics